our standard, our promise to you.
You're watching Capital City Sunday.
Welcome back. Joining us now is Cheryl Demars, the CEO of the Alliance. Thank you for joining me.
Thank you for having me.
So the Alliance, this organization, tell me a little bit about what you guys do.
Well, Emily, first of all, we're an independent employer-owned cooperative. We're a nonprofit. We were started almost 30 years ago by 7 employers in this community with the goal of working together to control healthcare costs as well as improve the quality of care in the community. And we do a number of things in service of that mission. We negotiate contracts directly with hospitals and doctors, pooling our purchasing power to negotiate better prices for the care that our employees use. We also make information available to our employees about the differences in the cost and quality of care so that they can make more informed choices when they need to go to the doctor.
Healthcare was a huge portion of these midterm elections. I think every race was talking about it. You yourself are headed to D.C. This week, actually, to testify before the Health, Education, Labor, and Pensions Committee, other known as HELP Committee. Tell me a little bit about why you're headed there and what your message is.
Well, first of all, let me just say that I think that that healthcare was such an important part of this last election and was on the minds of voters to the degree that it was, because frankly, healthcare is no longer affordable for many Americans. And those aren't just people without insurance. These are people who have coverage. Just a few statistics. Over the course of the last decade, our wages have increased on average about 26%. But the premiums we pay for our health insurance have increased 55%. That's the premiums, the amount that comes out of our check each pay period to pay for health insurance. In addition, deductibles have increased 212%. That's the amount that we pay out of our pockets before our health insurance ever even kicks in. So with wages going up 26% over the last decade, premiums going up 55%, and deductibles going up 212%, it's eroding people's ability to pay for other things that are important to their families, like education or housing. So it's really no surprise that this is top of mind for voters.
And when you go to testify before this committee, obviously you just said, you know, it's no surprise people care about health care, but paying for it it's a growing problem.
Exactly.
People just can't afford it or they don't have it. So you kind of have a 3-prong approach that you're going to introduce when you testify before the HELP Committee, kind of 3 innovations that your team is working with. Kind of talk a little bit about those when you do testify this week.
So the focus of this Senate Health Committee hearing, and it's actually a series of hearings, is on how to get our arms around healthcare cost control. And I was asked to represent the Alliance in talking about innovations that private sector employers are working on that are having an impact on cost control. So we'll be talking about 3 things. The first is pooling purchasing power, as I mentioned a moment ago, to negotiate contracts directly with doctors and hospitals. I'll also be talking about investing in primary care. And then thirdly, about shifting market share to doctors and hospitals that do a good job and cost less.
You mentioned investing in primary care. Is there a lack of funding for primary care, or what do you specifically mean by that?
Well, primary care has so much potential to not only help people maintain or improve their health, but also to control downstream healthcare costs. If we had robust, comprehensive primary care where people had the time that it takes to talk through health concerns and then have a primary care clinician who is really the quarterback of their health care, not only helping them maintain and improve their health, but also if things come up, helping them with accurate diagnoses, and then giving them information that helps them make the choices that are best for them when treatment's needed, we would see a vastly different scenario in healthcare, where people not only were healthier, but where our healthcare costs are lower. But today, we underinvest in primary care. Too often, primary care is sort of a feeder system for more lucrative specialists, and we want to change that.
I think we've mentioned a few times healthcare is very important to people. People want it. People want to afford it. I guess, how do we get to a point where healthcare is affordable? Is it, I don't think it's going to happen in a few years, but what is your approach, I guess, to get to that, to get over the hump? Because we know in Congress it's butting heads between both sides of the aisle.
Well, and that's, I think, the focus of the Alliance. It's on helping the private sector and public sector, helping employers work together to take control of healthcare, to make a change by working together in a local market. So for instance, I mentioned pooling our purchasing power. We contract directly with doctors and hospitals, and that helps lower the price that we pay for healthcare services for our employees. We also are working to change the market by moving market share to doctors and hospitals that do a good job and that cost less. And there are dramatic differences in both the cost and quality of care. I can share some examples.
Sure, sure.
For instance, in Wisconsin, you can pay $4,800 for an MRI of your knee, or you can pay, in this market, $970.
Big difference.
Between $4,800 and $970, exactly. And if you're willing to drive to Waukesha and go to Smart Choice MRI, you'll pay $600. Those are meaningful differences. And when people are paying, are in a health plan with a $5,000 deductible, that's money coming directly out of their pocket.
Now, one thing I do want to ask you is, do you think the Affordable Care Act is working? According to the latest data, Wisconsin premiums are 48% higher for people purchasing the individual insurance through the state or federal marketplace, which was created under the Affordable Care Act. We keep hearing premiums are going up. You know, some lawmakers say, oh, just wait, they'll go down. You know, it's a lot of he said, she said, this is what we expect. I want to ask you, who's in this industry, do you think it's working, or do you think there needs to be some tweaks to it?
Well, I think the Affordable Care Act solved some problems. I think it was intricately designed to have all of the pieces, like the individual mandate and even the excise tax and other components all working together. And it hasn't all evolved or unrolled as designed. So do I think the Affordable Care Act is working? I think it's solved some important problems, like eliminating the pre-existing condition issue. But healthcare costs are higher, and I don't think anyone can defend the status quo before the ACA or after the ACA. We have a lot of work to do to create the kind of affordable, high quality, reliable delivery system that we deserve.
Some U.S. Senator Tammy Baldwin and Senator Ron Johnson also said some things that will be likely up for this next, when Congress, after their inauguration, we have the new members sworn in, lowering prescription drug cost. You know, some people, we hear these stories all the time. I'm paying for a medication for years. It's only $60. Now it's $600. I want to get your views on that. Is that something that you will also be focusing on when testifying this week? Or is that kind of maybe another area? Because you said it's kind of many people are testifying before this committee, but I just kind of wanted to touch on that because it's a big portion of healthcare and healthcare costs.
It sure is, and that's I think it's also a visible and an egregious example of the rapid increase, unjustified in terms of the additional quality that you might be getting for that extra price. So it's a glaring example of where healthcare hasn't been held accountable enough.
And what makes your organization different than others who are trying to do the same thing?
Well, first of all, we're a cooperative. We're owned by employers. We're not an insurance company. We're owned by the local employers who are right here in Wisconsin and Northern Illinois and Eastern Iowa. And we also self-fund health benefits. And that's different than insuring. In an insurance company, if an employer were buying health benefits on an insured basis, they'd be paying a premium, a fixed premium on a monthly basis to cover their employees. When an employer self-funds their benefits, think of it as kind of paying as you go. Mm-hmm. They're paying just for the care that their employees use and no more. And there are benefits to self-funding that I think are significant. The first is when employers self-fund, they have more control over the benefit plan design. And that allows them to shape the benefits so that they make sense for their employees and their workforce. Colonoscopy is a great example. You just mentioned the Affordable Care Act. One of the things that happened under the Affordable Care Act is that screening colonoscopies were covered now at 100%. That's great, except if you undergo a colonoscopy and they find a polyp and remove it, now it's considered a diagnostic colonoscopy, and it's not covered at 100%.
Just one of those several examples that are happening in this ever-changing, I guess, health market. That is all the time we have for today. I really appreciate you coming on. Thank you so much. That's it for this edition of Capital City Sunday. I would also like to thank Scott Spector for